Tara, already? Good afternoon, beautiful day in Washington State. Congratulations, Seattle Times, who won a Pulitzer Prize for some of their work. And thank you for joining us. Obviously, we still have a long ways to go in our battle against COVID-19, but our recovery is moving forward, with outdoor recreation formally starting today in many respects. Additional guidance is being drafted as we speak for other areas that will be eligible to open in phase one of our recovery. And we expect more to be released in the upcoming days so that we can make sure we have appropriate guidelines for the reopening of those businesses, which I know people are very happy about. I've been very appreciative in the last couple of months of community leaders from across the state who have provided us such valuable insight about their efforts and their hopes and their struggles. We've talked to nurses and firefighters and workers and business owners and folks from every variety of nonprofits and elected leaders from across the state to help us move forward, and we are moving forward today in the state of Washington. Today, I am announcing 3 advisory groups that will be focused on specific steps that our state will be taking in the upcoming weeks. These groups include a really diverse group of voices, from community leaders in business to government to nonprofit organizations. They represent a broad cross-section of Washingtonians from both sides of the Cascades, different generations, and they focus on different parts of the impact of the virus on our community. The members of these groups are in touch with their communities, and I'm looking forward to working with them. They're going to help inform our decision-making, and they'll provide a vehicle for input with our administration to focus people's insights so we can make sure we get as much information as we can to guide our decision-making to keep people safe, which is our goal. The focus of each advisory group is the following: our Public Health and Healthcare System Advisory Group. This is be led by our Department of Health Secretary John Weisman. We'll have our Safe Work and Economic Recovery will be led by Commerce Director Lisa Brown. Our social supports with the Department of Social and Health Services Secretary Cheryl Strange as our cabinet lead. Director Brown and Secretary Strange are both here today to answer questions. I want to thank each of them for their leadership to date in working with the community in this group that we're now forming. Each group will really constitute a forum for my office to consult with the broader community on the next steps as we move forward of reopening our state. For example, our Public Health and Healthcare System Group will be looking at broadening our testing efforts to do everything we can to maximize the ability of Washingtonians to obtain timely tests, to help us prepare for a potential second wave for COVID-19. And they'll prepare for the distribution of treatments and vaccines in the happy day when those, in fact, are perfected. Our Safe Work and Economic Recovery Group will focus on our phased recovery plans, giving guidance for allowing more activities with appropriate health standards and business and worker assistance. We want to ensure a safe path moving forward, both for people who work in businesses and for their customers. And make no mistake, we do know that things will be different as we recover from this matter. But we're looking forward to getting the best advice we can from across the state, and this group is going to help us do it. We don't know exactly when these efforts or when the go button will be pushed for the next steps, but we do know how to do it, and these groups are going to make sure that we understand the best way to go about doing that. Our social supports group will look at meeting the increasing need for so many basic human services, from food to safe shelter to housing and health care. And they'll look at the recovery that through the lens that addresses the equity, the need to increase rather than decrease equity as we go through this challenge. We know our vulnerable populations have always had stresses, and we want to do everything we can to minimize those in the face of this pandemic. This is a tall order, but I'm glad we're going to have this group working on it. I want to thank each member of these groups to help inform this critical work. And we'll have the list available for the press of the members. I'm joined today by 3 other speakers. They're Justin Farrell, who's Senior Vice President of Civic Ventures in Seattle and a member of our Safe Work and Economic Recovery Group. and Michael Bayun, Executive Director of the Asian Counseling and Referral Service in Seattle, who will serve with our social support group. Also, Allison Paulson. Allison is Executive Director of Better Health Together in Spokane, who will serve on our public health and healthcare group. So let's kick it off for a few comments. Jessen, I think you were going to go first. Is that right?
Yes, it is.
Thank you.
All right. Thank you, Governor Inslee. Thank you, first of all, for your leadership as we are going through an unprecedented public health and economic crisis. And thanks as well to your staff. And thank you to Director Lisa Brown in your role as Director of the Commerce Department. I am honored to be the community lead for the Safe Work and Economic Recovery Task Force, and I want to thank every member of the task force for choosing to serve the state in this way. I'd like to emphasize that the scale of the economic crisis is unprecedented, and that the scope of our solutions are therefore going to have to be properly scaled to the scope of this crisis, and that we will have to come to this work with boldness and creativity and a deep attention to the public good. I would also like to emphasize that parts of the workforce were already economically fragile coming into this crisis, and that we will have to pay particular attention to particularly those folks on the front line, whether it is people in the service industry, childcare workers, parts of the medical community, nurses, other people who are providing services in our hospitals. There were many elements of our workforce that faced economic insecurity going into this crisis, and the crisis has only made that more acute. So we will have to pay particular attention to that. And of course, the impacts are unevenly felt by sector. Some sectors have been almost completely closed down, and so the nuances of a sector-by-sector approach will be something that we will pay particular attention to. And of course, we will be prioritizing the science and the public health and safety of every single resident in Washington State. So again, I'm really honored to be able to do this work with the members of the task force and serve the residents of Washington State in this way. Thank you so much. And now to Michael.
Yes, again, thank you, Governor Inslee, to your executive team and members of your cabinet for your wonderful leadership during this time of crisis. As we know, health concerns is the center of this crisis. We also know that our background determines the severity of the pandemic's impact. In terms of race and ethnicity, Pacific Islanders, African American, Latinx, and Indigenous community folks are disproportionately impacted. We also know socioeconomic background is another factor. People who are undocumented, members of our COFA and other immigrant communities are also disproportionately impacted. Individuals with special needs have extra challenges in navigating the system and to receive support necessary during this time. And lastly, geography plays an important role. Whether you're in a rural community or in an urban setting, this pandemic impacts us differently. As we are part of this social supports group and working with the governor's office on the recovery plan, we want to make sure it's comprehensive and that we do not leave anyone behind. So our goal and our charge will be to focus on a holistic approach, recognizing the importance of coordination of support, social service support, including mental health, food, housing, and other services. And most importantly in this process of ensuring that we center equity and inclusion. And so we look forward to this opportunity to join others in this effort. Thank you. Now I'd like to go ahead and pass it over to Allison.
Thank you, Governor Inslee. I have been so proud to be a Washingtonian under your leadership these last several weeks as we have responded as a state to the COVID response. It's an honor to represent the good people of Eastern Washington in this important work group. I'm super excited to join this distinguished group of experts to ensure that our communities are really well supported as we move into the next phases of the COVID response. I'm especially committed to making sure our communities of color and our rural to get Washington back on track. I'm proud of how Washington has pulled together as we've made our way through phase one. We've already seen hardship endured by so many, and we know there is more to come. We must ensure that our health systems are ready, not just for a possible second wave of the virus, but also the increased behavioral health needs that our frontline workers are experiencing, that people who are experiencing financial hardship, and quite frankly, every one of us is experiencing grief for missed graduations, weddings, and family gatherings. This is a time for us all to stay connected to a common vision of health for everyone. I look forward to working with this group to ensure that our health needs are balanced with our desires to get back to normal. Thank you.
Thanks, Michael and Justin and Allison. I want to thank you. I think you're going to really help us making sure everyone has access to this effort to give us insights and input. This is really going to help us in that regard. We, of course, going to retain decision-making capability. That's our responsibility. But this is going to be very helpful in organizing the views of Washingtonians so that we can make the best possible decisions. With that, I am going to, I've been called away for 2 minutes. If folks can wait for 2 minutes with me, Tara, can you defer for 2 minutes? I will be back in about 2.5 minutes. I have to give one decision to someone. I'll be right back. Thank you.